Mr. Speaker, today I introduce the 21st Century Women's Health Act to increase access to reproductive health care and to provide compassionate care to survivors of sexual assault. Funding for the government runs out in a matter of hours. Rather than crafting a bipartisan solution on the nation's budget, House leadership has been focusing on denying women their right to make their own health care decisions. This is 2015. We should be doing all we can to increase access to health care for women. We should not be rolling back women's rights and cutting access to life-saving cancer and preventive health screenings for women, men, and youth across the country. As a mother, a daughter, and a member of Congress, I understand the value of increasing access to health care for women, and that's why I'm proud to introduce the 21st Century Women's Health Act with my colleagues, Congresswoman Barbara Lee, Congresswoman Diana DeGette, and with the leadership of our ally in the Senate, Senator Patty Murray from Washington. This comprehensive bill will increase access to preventive health services and contraception for low-income women, and it will help women reduce instances of inappropriate charges for birth control, a problem that affects too many women across the country. It will also expand the primary care workforce and ensure that survivors of sexual assault are provided with free emergency contraception and compassionate care. I want my daughter and every woman in this country to live in a place where they have access to affordable health care providers like Planned Parenthood, a full range of reproductive choices, and most importantly, the ability to make their own health care decisions. Colleagues, I grew up before Roe versus Wade, and I know what our country looks like when women don't have access to a full range of reproductive health care options. We know that if abortion is restricted, it does not go away. Let us not return to a time when women had to seek care in the shadows or the back alleys. Let us come together to prevent unwanted pregnancies, and let us champion our march forward toward a more equal society with the introduction of the 21st Century Women's Health Act. I urge my colleagues to join me as co-sponsors, and I look forward to working toward the passage of this important bill. Thank you, Mr. Speaker, and I yield back the balance of my time.